All right, and we're live. Andrew, appreciate you being on the podcast, man. How you doing?
Doing well. Thanks for having me, guys.
Yeah, so we had I think we were talking on LinkedIn, and then we ended up connecting and having a conversation. And I didn't really know what you guys were doing over at NanosVet, and we'll kind of get into that. But as soon as I heard, I was like, and I probably had the same reaction you had when you first had that light bulb moment. It was like, wait, this doesn't exist. So we'll get into all that because I think it's fascinating. I think it's incredible what you're doing. But before that, maybe give a little bit of background on, who you are, what you're doing, and kind of what led up to this whole light bulb moment that you had.
Yeah, absolutely. So I'm Andrew Green. I'm the founder of NanosVet. NanosVet, we're on a mission to replace all pills and needles for medicine delivery for our pets. Something that we know a lot of people have a lot of personal challenges with. Anyone who's kind of covered pills and cheese or peanut butter or has had to rush to the vet to get some kind of injection has lived that problem. So been a really exciting one for me to go after. And Roy, as you mentioned, one really personal for me. So I have two dogs, golden retriever and a boxer. And after spending a career in technology, B2B SaaS kind of venture, this has been an awesome journey. Kind of moving into the pet health space with all the builders and investors and just incredible people along the way. So I spent most of my career building incubators and accelerators and corporate venture and venture studios, but mostly in the technology space. So did that as a consultant for a while, and then did it for AB InBev, which was Budweiser's parent company.
Mhm.
So we had our typical corporate innovation lab out in Silicon Valley. We were building software startups inside of a large CPG giant. And then about 3.5 years ago, I moved out to LA to launch Struck Studio, which is a venture studio out in LA. So we raised a fund from some top VCs in the country, and with the goal of actually building software startups ourselves. So the through line for my career is finding new ideas that are worth building, going from 0 to 1 on repeat, finding great problems to solve, and really going after it. And that's really led me to Nanos Vet, only when it got really personal instead of your typical B2B SaaS.
Yeah. So, okay, so now we have the background. Tell the story of that moment where you go to the vet, you realize how on earth does this thing not exist, and then you're like, well, it doesn't exist. I might be the one that has to build it.
Yeah, yeah. So we moved out here from New York to LA. And I admit, and I committed on this podcast because we're all animal health people. I moved across the country because my dogs needed a backyard. The Manhattan apartment life, through Central Park, it wasn't cutting it anymore. The dogs needed some space to run. However, having grass and trees and all of that came with all of the other things that come along with it. And my boxer actually got stung in the face by a bee. So her face swelled up, and at first it was a little bit funny. We've all seen kind of the Instagram post of the dogs with the
Yeah.
porcupine or getting swelled in the face, but I tell the story that it quickly became unfunny because she fully collapsed on the floor, was not responsive, and went fully anaphylactic. And it was really scary. It was one of the scariest moments. We thought it was over, and we don't really have, you kind of feel helpless, right? There's not much you can do other than get in the car and go to the ER as fast as possible. And we were very lucky they got her stable. But when I spoke with the vet afterwards, they said, "Great, thank you so much. What did you do?" They gave me the rundown. They said, "Yeah, we gave her epinephrine and Benadryl and prednisone." And for me, my ears started perking up a little bit. I was like, "Oh, super interesting. That's how I was treated as a child when I was anaphylactic and I went to the hospital." So it's really the same medicine. It's the same process. And so my obvious follow up was, "You're going to send me home with a dog EpiPen." And the vet just looked at me and said, "That doesn't exist." Right. And so alarm bells, right? I've spent my entire career finding problems to solve. And I'm like, this is really interesting. There's got to be a reason why. And that really kicked off the journey, of why that doesn't exist and led to ultimately what we're building today.
Yeah, I feel like that's the through line with all great entrepreneurs. It's either someone telling you this doesn't exist, or you, I don't know, buying a product and like, wait, this is the product? Like, how am I supposed to use this? This could be so much better. It's always the through line of problems or non existent or having some issues with the service, with the thing,
Yeah.
and then just being like, I can do this better, or hey, I have to go to the lab and figure out how do I make this from zero to one, at least some sort of MVP or something along the likes.
Yeah, I mean, it's the problem you can't stop thinking about too, right? So
Yeah.
I had to go home and the bees in my backyard didn't go away, right? So now this is just something that's constantly, hanging over my head, hanging over my wife's head. What do we do if this
Are they
happens
still there,
again?
by
And
the
we
way?
have no, oh yeah, oh yeah. I mean, they're around. I'm not in the city anymore, right? It's
Yeah.
nature, right? And that's great. And bees are awesome. Nothing against bees, right? I just got to make sure that my dogs are protected. Even the follow up then became the next day. I now have a new regimen for her of things that of pills that she needs to take every day. And so while the big pain point, right, is obviously where we can replace kind of needles and create these emergency use cases. The basics, the foundation, right, is still really challenging. I need to go through a whole production, right, just every single day to get her kind of these basic pills and medication she needs. So huge problem, and one that I found that everyone I've spoken to, you own a dog, you own a cat, everyone's got their own story around how they're trying to solve this problem for themselves.
Yeah. I it's it's funny, like before realizing what you set out to do, I was just like I was like, this is so, I mean, not the mechanism, which we'll get into, was such like an aha moment, but it was kind of like, yeah, this is, man, like modern medicine for pets has been around for quite some time, and like I was shocked that that wasn't a thing that existed. So basically, you have this problem. You come home, it's your aha moment. Like, this isn't like going and starting a treat company where you go find a co-packer
Yeah.
or whatever. Like, there's a lot of moving parts to this. So walk us through, what was like your next step. Did you pick up the phone and call somebody? Did you go to the drawing board? And then we can get into like how this is different from a traditional EpiPen of sorts.
Yeah, I mean the first step, right, was again like I'm a software technology builder investor by trade. I'm not a vet, right? And so those are the first people I needed to talk to. So I need to go talk to as many veterinarians as possible to understand why this doesn't exist. I was actually really lucky. I lived during my undergrad. I actually lived next to the vet school in Philadelphia where I did my undergrad, and so I just by nature of being there, I actually knew a couple of people who had graduated from that school, and they were like the first calls, right? The people that you never would have thought, 20 years later that you're calling back to like, connect with and ask questions. But the outcome of a lot of those conversations was that, epinephrine is clearly not the problem. That's the known solution. That's how this is treated. It was the modality. It was the
Yeah.
mechanism. An EpiPen itself is not made for animals. The dosing is wrong. The needle is too short, so it can be really tough to kind of jab. It's also they all said very lovingly that all of our pets in the U.S. are a little overweight, between the fur, and that makes it even harder for the needle to get through. They're obviously traditionally, everyone knows the story of EpiPens being really expensive, and while we're spending way more on pets than we ever were before, it is a little bit different still, in that realm. And then the last thing that I thought was so interesting was there's a level of trust that a veterinarian has to have in the pet owner. They have to believe that the pet owner can actually, utilize the medication or the delivery mechanism successfully and not create more problems. And people just are really uncomfortable in jabbing their pets with a needle. They want the comparison that people gave me was, if it's one of us, right, we kind of get what's going on. It's an emergency, and we're going to figure it out. We're just going to jab the EpiPen relay. Even if it's a young child, depending on their age, you can communicate with them and say, hey, this is what's happening. It's not going to be easy, but you can actually have a conversation. Unfortunately, we can't talk to our pets yet. So it's not really something that you can work through. Like
Someone's
they're
working
gonna
on it
freak out.
right now.
I know.
Yeah,
I,
I'm
I, I
sure.
hope
Yeah.
I hope they get there. And then maybe that destroys our whole business here. But that would be a great problem to have. So so there's a lot of really good reasons, and that was kind of part of that aha moment, right? That's like, wow, it's not the medication, it's the modality, and the realization that no one has innovated on the pill or the injection for like hundreds of years, right? And they certainly haven't thought about it in terms of what's best for animals. And that became like the catalyst, right, that moved this from this is a really interesting small passion project for epinephrine to this is a venture scale problem where we have an opportunity to just revolutionize the foundation of how we're delivering, medicine to animals.
Yeah. It's so I guess what like okay, so the EpiPen you've it's the needle's too short. We got some fat pups and cats around, a lot of things, and that's like an existing format and modality that would be the most, transferable. But
Mm-hmm.
considering all the issues with that, like, I guess walk us through what your solution to work around the EpiPen is, and like kind of why didn't you go through with like redesigning that, right? Since like I'm sure there's a lot of suppliers, players in that space. Like maybe it makes sense to do that. I know there's like, people are fearful of popping a needle into their pets, which I totally understand. But maybe walk us through some of that logic as to why you're not kind of redesigning that and like what you're doing as an alternative.
Yeah, I think it's like the classic. Let's not build a faster horse, right? Like let's think about the best way to deliver this and like what the issues really are. For needle, right? It's something that can be painful, can cause more harm. A lot of aren't uncomfortable. We're comfortable, giving some kind of oral medication, but pills can be easily spit out. The stories of people who they find the piles of pills hidden behind the food bowl because, like, the dogs never actually ate them, right? So how do you actually improve that level of compliance? And I know we've talked a lot about the why, but the real answer, right? When I was talking to all these veterinarians, they all said to me like, "This is amazing. So how are we going to do it? What are you going to do?" And that's really where the magic is. So I ended up getting connected with a company called Nanofiber Solutions. And so Nanofiber Solutions is an incredible group, some scientists who are using nanotechnology to spin medical fibers into kind of this new modality. So what's really interesting is the technology's been around for a while. They have two FDA approved use cases in humans right now for their underlying tech. And basically, the way to think about it is they're able to spin fibers into these patches that can be put on like burns or tendons for humans. And that nanofiber kind of structure creates better scaffolding for being able to quickly repair and regrow those cells for a tendon or a burn. The realization was that structure that mirrors the extracellular matrix of the body could also allow for better mucosal absorption, so something that actually gets absorbed through the mouth. And that's where the idea from them was born. Wow, we can actually put this medication onto a strip, right? So the best way to think about it, that my comparison for everyone is, everyone remembers those old Listerine strips,
I
you put in
was
your mouth.
just gonna
I
the
don't know if you
first thing I
saw them.
thought of when I
It's
saw
everyone
it.
pictures, right? Yeah, so
Yeah.
very very similar in that modality. The difference is, those strips, the way they kind of function, the simplest way is that they kind of spray the material on the outside of those strips. So when that Listerine strip dissolves, it's just going to your stomach. So you still have to go through that kind of the absorption through kind of that stomach route. But with this nanofiber technology, what we're able to do is actually spin the medication, spin kind of that API into the fibers of the strip itself, which is what allows for that mucosal absorption to happen. So when you put it in your mouth, you're actually absorbing it directly. It's not going to your stomach. And so beyond just the fact that we're replacing a needle, now we can get faster onset, more efficient onset, so we can get more of the medication into our bloodstream without the volume that you might need in another way to pass through all the other systems. And all of a sudden, anything that requires like a rapid onset or that emergency kind of situation becomes a really exciting use case for it. The other benefit is that naturally, by the way the strip is done, it's also tacky. So if you put it into your mouth, it's very hard to spit out. Which, when it comes to pills, is like the real exciting aha moment. All
Yeah.
of a sudden, once it's in there, a lot harder for your dog or cat to kind of expel it.
So you can see this expanding from EpiPen is just the first thing. It can go into all these other areas that it needs a syringe or a pill, which, my dog, she, even through food, she somehow finds a way. When I stick it into like something, she finds a way to like spit it out. I'm like, dude, how did you even find it in between that massive chunk of meat? But
Yeah,
so
yeah.
you're saying there are, I don't know if this would be applicable to all, but definitely some of the things that currently we're using pills and syringes for?
Yeah, absolutely. So this is really a new modality, right? A new
Yeah.
platform. So the goal would be to put as many medications as we can, into this modality to make delivery easier. Epinephrine is just a really interesting wedge, right? Because it's a product that doesn't exist on the market. We're very familiar with it from a human use case. We know how to operate it. We know what it means to have a preventative anti-anaphylaxis medication, but this applies to so much more. And what's been really amazing for me is that the vets that I'm speaking to are building my roadmap for me. They're telling me exactly what they want next. So, some of the things that came up is, at home treatment for seizures is like a really interesting one.
Ooh, yeah.
Things like anxiety or nausea, right? Where those are usually treated with pills today, but fast onset's important. If you're about to take your dog in the car for a road trip and they're anxious or they get really nauseous, not needing to plan ahead an hour to make that work, right? And like those are some examples there. And then maybe my other one, the favorite that got brought up was apomorphine. And if you're not familiar with the medication itself, that's what if your dog eats some chemicals or a chocolate cake off the table and you rush them to the vet, that's what they deliver,
Mm-hmm.
usually via eye drops to induce vomiting. And so that's a really
Oh, they have
expensive
that
vet visit.
charcoal thing, right?
Yes. So
Yeah,
yes, I think
activated
Dr.
charcoal.
Cuddles,
Yeah.
I believe, like amazing product, right? And but they're trying to find other modalities. Imagine being able to do that yourself and solve that with just a small strip, and to keep that, in the
Vomit
cat.
strips.
Exactly.
Amazing.
Yeah, there you go.
Yeah.
Trademark that now, Kyle.
Yeah,
So
love it.
yeah. So it's really cool, right? The expansiveness is really interesting. We've also had some interest even on the kind of commercial farm animal side, which is even further out, right? Our focus has definitely been on companion animals, small animals, your dogs and cats, but to be able to do this in mass, right, for other animal groups, cows, for example, could be really interesting as well.
Yeah. You're gonna need a bigger
Yeah.
strip for those.
Man, sure.
It's gonna be a whole paper sheet
Yeah.
for cow's tongue. That's really cool. Like as you were mentioning all the other use cases, I was like, oh, okay, all the fast stuff that you need, like immediacy. And for me, I'm very fortunate with the two dogs I have now. They'll eat rocks, like they'll eat anything. So
That's
I
awesome.
don't
Yeah.
have
You're very lucky.
that issue. I know I know that because all my other dogs were not that way. So very lucky there. But I started thinking of, like, we haven't done it in a while for my pity mix, but he had to get Cytopoint like injections, and he
Perfect
just hates
example.
going to the vet. Yeah, and I was like, man, for skin inflammation, like he just has so much environmental allergies, and it's so annoying. Like it's annoying in that it's just a constant inconvenience. But something
Mhm.
like that, to be able to like reduce inflammation so much easier than having to take them in,
Yep.
and it could be
So
fast
allergies
acting.
are the number one reason that people bring their dogs into the vet, like itchiness. And so there are a bunch of
Yeah,
solutions just in that category. My boxer's the same. We
yeah,
bring her quarterly, have to go to the vet to get her Cytopoint injection, and
yeah,
work through that. And so there's so many of those. And what I love too about this is, we're so excited about the platform and the modality. It gives us so much flexibility in the way that we can bring the solutions to market. Things like epinephrine that are generics, they're well known, there's no competitor on the market. We can build that ourselves, right? And take that through the FDA process and go deliver that. But there are some things that, Zoetis and Elanco and Merck and Mars are already doing great things. We can partner with them, right? And help take whatever drugs that they're manufacturing and help them put it on a better modality to deliver it. So, Cytopoint's like a great example, right? It's like an awesome product that is owned by those guys and would be a great kind of partnership. So there's a lot of flexibility there. And for me, right, that's where the passion comes into this for me. It's, obviously huge business opportunity. We're very excited, but me, like a lot of other dog owners, just want all this stuff to exist, right? I need it for
yeah.
myself. That we've got, I've got to make sure this works. Otherwise, I'm going to hear, from my wife that we, that it's so too challenging to go take care of our dog. So
Yeah.
very personal.
So could you? Okay, so I'll ask that one later. But I think the natural question is, I think there's a always a crossover and it goes both ways, right? When you have different trends going on in human health, eventually those tend to come into animal health. In the past, it used to take many, many years. Now it seems like it's months or I don't know, a year or two. But it also can go the other way. For example, with Loyal, like I know they're obviously working on longevity for dogs, but they're
Yep.
also interested, like if this works in dogs, could this work in human health as well and potentially have success in longevity, in human longevity? Could this do that same thing where this crosses over to, because most humans, they're not really fond of needles, and
Yep.
if you could offer them something like a strip, like a Listerine strip, that could give the same results, that's it seems like a no-brainer if it works.
Yeah, yeah. So the parent company, that kind of still owns the IP, are exploring human use cases also. So it absolutely applies. I think one thing I've learned is that the FDA process though for animals is actually just as difficult. So a lot of people have
Is
this
it?
preconceived notion that it's easier. It's easier. It's not easier. The bar is just as high. It's just a bit shorter, right? Because instead of needing to go through the journey of let's test it, in a lab, test it in mice, test it in dogs, and then humans, we just get to stop at dogs because that's our end user. But the bar to get there is just as high. So that was kind of the advantage of saying we're going to kind of carve out and go and build a company around the entire veterinary use case, as the underlying kind of IP is explored for humans as well. But you're 100% right. Like personally, for me, there are a lot of medications I'd much rather take as like a flavored strip, right, than getting injections or doing that stuff myself. So
So is the idea with the first kind of EpiPen alternative to basically box that into a pharmaceutical as its own standalone brand that then vets are prescribing, or what's like the go to market strategy once you've gone through the god awful process of the FDA approval? Like, how does that populate into the marketplace?
yeah, yeah, for sure. So it'll follow kind of the distribution model. A lot of these other things, usually going through vets. So it's going to be something that requires a prescription, but that can either be fulfilled directly at the vet when somebody goes in. And the way that we think about it is it's not just somebody who's been anaphylactic, right? But for all of those people going into a veterinary clinic with a dog that has severe allergies, that generally means they're at risk. They could be at risk, and it's something that they could buy a preventative means and prescribe when they're at the vet. So it can be done directly through the vet. It can be done through the marketplaces like a Chewy or an Amazon. But largely, kind of the vet is the partner, right? They're the person that's going to help make that assessment and kind of give the green light. That said, right, one thing that's so exciting about this for me is just the natural pull from the end user, like the pet parent and the consumer. There's we actually discovered that on TikTok there's an entire genre called pill hacks, which is just like videos of people coming up with funny ways to try and get their dogs pills and injections, and like that's the market, right? Those people who
Yeah.
have to create an entire production that makes social media content about it. Those are the people that I think we can create a lot of pool from as well. Because I just
Yeah.
my
Just created so
hypothesis,
much
right, is
unemployment on TikTok.
well, now they can show how easy it is, right?
Yeah.
So yeah,
They've got nothing to do now.
cool. They can come work with us.
Yeah.
That'd be great.
But so like
That's fun.
I guess my question is it going to be like a standalone thing, like a Simparica Trio, which of course it needs to be
Mhm.
prescribed by a vet, but it's like you're going to build a brand and like a identity and a package around that, as opposed to just pure licensing for somebody else to lump
Yeah,
into.
for the epinephrine product for sure. I
Yeah,
don't think we have our trademark name yet, though. Everyone is already calling it EpiPet just because it's a little bit natural.
that
But
checks
like,
out.
yeah,
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 Yeah.
yeah. So we got some work to do there, but yeah, I mean, it'll definitely be its own standalone product, and it's great, right? Because it puts us in a place where we kind of put our money where our mouth is, right? Like as a team, as a new startup, we are going to put this product out in the market ourselves and really validate this delivery platform, to validate this modality. Once we can show that we can do it with this well-known kind of treatment, it makes it a lot easier to either build the next one or partner on the next one with some of the existing manufacturers.
yeah. So have you kickstarted the FDA process yet?
Very, very early stages, so a lot of our work
Okay.
has actually been done in like kind of the lab and the prototyping. So, we've gone through the process of proving that we can successfully get epinephrine onto a strip into that kind of modality. We've done a lot of lab testing that shows if you dissolve that strip that it can successfully cross, the mucosal membrane, right? Which is really the test to say, yes, it gets absorbed. One thing that's really interesting is different medications have different absorption rates. Some are done easier than others. The classic example is like nicotine. Nicotine is very, very easily absorbed, through the mouth, and that's why, that's already a well-known kind of mechanism
Yeah.
for that product. Some are more difficult, right? And so that's part of that experimentation to think about it. Epinephrine, very luckily, is pretty easy, which means that it doesn't take a high volume of the substance itself. Means we can put only a little bit on a strip and get really great absorption. And that's kind of that last test before now going into some of the more clinical work that we need to build the package that goes to the FDA for approval.
How did you don't have a medical or veterinary background, right?
I do not. I do not.
How did you, because if I have an idea and I want to go into the CPG space, or I don't know, I want to build some sort of a tool or something, I can kind of I have a rough idea, right? Like I can do a little bit of online research, but the medical world is just extremely difficult for obvious reasons. How do you start to understand the lingo? How do you start to understand the process and what you have to do? And what are these things even connected? And what are these big names that we don't understand? Like
Yeah.
how does that process happen for you? I feel like that alone would take a long time. And then on
Yeah.
top of that, having to build, or are you just incorporated to learn on the fly and then just figure it out as you go?
I mean, it's all of the above. So, I've operated in venture for a long time, building early stage companies and investing in early stage companies. And the one thing I think that any investor, someone in venture will tell you is that context switching, right? And being able to learn a lot really quickly about the space and make
Mm-hmm.
a, logical judgment is a key kind of part of that role. So there's definitely some of that muscle memory there. But the other piece really is just elbow grease, man. It's like getting in the space, putting in the work. This isn't something that happened overnight. This event with my dog actually happened 2 years ago. And it's been a journey since then of learning and educating and digging in. And I think to our original point, right? That's why some of the best ideas come from personal experiences with founders, right? In any industry, because if you don't have the passion to go after it, it's really hard, right? It's
Yeah.
it's a lot of work to learn a bunch of stuff you don't know anything about, become an expert on it, and be in a place where you can speak to that kind of use case in an educated way. And you just have to be excited about it. You have to wake up every day thinking this is a problem that I want to go solve. So that's a big piece of it too. Just putting yourself out there and saying we've got to do the work and learn it.
So I'm
Yeah.
assuming now you're in R&D stages.
Yeah.
You're raising capital. You're again doing all the startup stuff, but you're also trying to prove that this works. I don't know, how much you can share, but what are some issues that you're currently seeing? And like, okay, like this is not like what we thought originally. We have to tweak this. We have to fix that. We have to,
Yeah.
whatever goes inside the crazy labs that produce this.
I mean, it's really interesting, right? So the way that you can think about it is you have to create a solution that ultimately gets spun into these strips,
Yeah.
and that solution can have a bunch of things in it, right? So it's the medication itself, but that's where you might also put flavoring, for example. So one challenge with this technology that you have to work through with every medication is volume. There are certain things where if you have too much volume, the strip can either become a little bit too thick or be too large, or you get in a space where you might need to give a dog 2 strips, right, to get that amount, which is also fine. We do that with pills, and I still think that's an advantage. But that's one thing that on a medication by medication basis we have to explore. You might then find also that to make it shelf stable, it requires other kind of organic polymers that need to be included. So that's the experimentation to get that formulation correct. And it's a lot of boxes to check, right? It's
Yeah.
making sure the formulation is correct, making sure you have enough medication, understanding what the absorption rates are so that you can dose it correctly, because it's not a one-to-one with an injection, it's not a one-to-one with a pill. I think like those are a lot of the challenges. But I'll show you guys because I actually got this is really fun. We got some samples. It's hard to see, but this is a caffeine strip for humans. Like you know,
Oh,
this is like
really?
this is like our demo strip, right? So there's like 25 milligrams of caffeine on here, which is great. So if anybody's in the space and wants to come hang out at the next animal health conference, I'm gonna get a bunch of these and hang out at the booth. And if you instead of a cup
That's
of coffee,
cool.
come hang out with me. But it's like a great example because like I can use this and put it in my mouth, and like I'm putting in my mouth the things that I'm asking my pets to do, right? But
Yeah.
it's a really
Yeah.
great way to experiment with different things and show the flexibility of the modality. But the way the caffeine goes on a strip, and I think that's marshmallow flavored or something. It's all of those things have to come together and build the right formulation.
Wow. Yeah, that's definitely an art in itself, and I always wonder with this because we actually spoke with Dr. Linda Black, who's the CEO of Gallant, and it's like,
Awesome.
it's like the formulation side of things and getting things done is a whole process and time in itself, and like to predict when you're gonna achieve that is like I would imagine next to impossible. And then it's like that journey to then getting something on the shelf and the product, like they've been at it for 6 years, and like they're getting really close for their first product, which is essentially stealth or shelf stable ready to go stem cells. And so it's
Yep.
like I'm curious if you have any kind of like rose colored lenses on right now, like when are you hoping and praying to potentially have something on the market?
Well, it's part of the strategy of our platform. Right? The way that I think about this space right now is this: there are incredibly smart people doing amazing things for animals. New stem cell therapies, cancer drugs, longevity things. On a one by one basis. And I, as a pet parent, I need them all to exist. I want them all to exist, and it's really awesome to follow their journey. I've taken a route saying I'm going to help solve longevity also, but I'm going to do it at the foundational level, right? Like let's reinvent the foundational way that we're getting, medication to our animals. One of the things that a lot of vets will tell you is one of the biggest challenges is compliance, right? Like they can diagnose and schedule a treatment all they want, but if that medication doesn't actually get to the animal, they're not going to solve their problem. Right. So I'm saying you guys are going to attack it from that side. I'm going to help attack it from the foundation, the other side. And we're going to meet in the middle and extend the lives of our pets. The advantage of that though, Colin, for me is that I'm not going after net new therapies, net new therapeutics, net new drugs. I'm going after things that are already known and on the market. We already know what the blood concentration level needs to be based on the existing intramuscular injection or the pill. So my goal is to take these kind of known treatments and just change the modality. So it puts us in a position where our goal is we got to go prove, to the FDA that our modality is safe, but it can deliver the same treatment, as the existing solution. And so while I think no, you should never downplay the difficulty of getting through an FDA process, right? So taking off the rose-colored glasses, it is challenging. You never know what answers or what feedback you're going to get, but it puts us in a position where our hope is that we can get to market much faster. Epinephrine is a really interesting one that's really unique because we believe it's going to qualify for what they call MUMS, which is minor use, minor species. Basically, the government wants to incentivize you to go after treatments for a small group of animals or kind of emergency unique use cases. And the belief is that, anaphylaxis can fall, into that category because the only data they have on it is in clinic anaphylaxis, not all the times that it's actually occurring or could be prevented at home. And so because of that, you're actually able to get to market with just a conditional approval. So with conditional approval, you can now actually start to sell the product under certain communication. But they say, great, if you can give us directional evidence, that checks these boxes on safety and dosage and effectiveness, you can go start selling this into the market.
Wow.
And we believe we can do that in less than 2 years. And
Wow.
that's the uniqueness of this platform, right? Being very strategic around the different APIs that we're going to go after, where we can either meet that criteria and be in a place where we can get to market a little bit faster. So it's definitely unique in that sense, and that's one of the reasons why epinephrine is such an interesting wedge product. It's certainly not
Yeah.
a daily use category, but it's an emergency situation. We know how it works for humans. People use it in a preventative manner, and it would qualify under this path.
Yeah, that's really cool. Like to your point, like just changing the modality, it's like you have a lot of benchmarks to go off of. So I'm sure it's
Yeah.
just like, you're not, not net new. So, yeah, that path is much shorter,
Well, and
which
cues
is
we can
really
take from the
cool.
human space, right? Like,
Yeah,
so
yeah,
we know how EpiPens are handled and used. And there are other people kind of exploring other modalities, nasal modalities, other, non-nanotechnology strip modalities in human. And while you can't just kind of copy paste, the way that we're going after this, we get to be the beneficiary of some precedent that's been set, and puts us in a
yeah.
position where we can kind of bring those packages to the FDA really buttoned up much faster.
That's so it's funny when you were mentioning like it's all done in the like everything's basically clinical and it's like done in a lab setting and like testing all these things in the real world. For some reason, I just remembered too like some of the craziest stories, and these are I think occur much less than like an anaphylactic reaction, but is like snake bites,
Oh yeah,
especially out
yeah,
west. And I was just like, that's like a whole nother.
interesting.
I mean, I don't know anything about like, because I know a lot of times like there's stuff that may need to actually come out, like from the injection point or from the bite point. Like there's like maybe
Mhm.
extraction plus like you're giving them something. But that was like I was like, oh my god, that could be a really insane use case too. It's like it's got my wheels turning on all these different things that are like super imminent and like life threatening. That I mean, if you were able to get this to market
Yeah,
and then being able to jump over to a few of those other kind of, which I feel like with venom, it's very different because there's different species, they all need different antivenoms. Like I'm sure there's a lot of complexities to that, but it just made me think of that. I was like, man, that would be
I mean
insane.
the different value props of this modality, what it can give you. Right? So you're talking about hyper emergency use cases, fast onset's critical. You need to be able to have it with you, right? Like the packaging is a big deal. Like you're not just going to carry around a syringe and like a vial with you, right? Like
Yeah.
this is a tiny strip in packaging. You put it in your wallet, in your purse, in your car, and keep it with you. There's that side of things, and then the other one that came up recently on the kind of commercial farm animal side is they're really excited because anytime you can avoid damaging muscle into a farm animal is really critical, right? So anytime you're going to stab into muscle, that's damaging the muscle of the animal. They can just do that strip instead. It's a really compelling use case, right? So to your point, like the more we've dug in, the more expansive the opportunity has gotten. It's so cool to watch it just continue to inspire people to say, what about this? What about this? Have we thought about this use
Yeah.
case? And I love it, right? You get to take it all in. And obviously, we have a lot of focus and prioritization to do. It speaks a lot to the size of the opportunity.
With the I'm curious, it got me thinking like you're in the wallet, in the car, like with the caffeine strip, is there like a melting point? I'm sure there is, like where it's like if it's sat in your LA car in the middle of July, for days on end, like I mean that's a big consideration, right? And then how are they
Yeah.
like individual packets that you're having to think about? Have you even got to that process of like thinking through some of those
Yeah.
issues?
I mean, we've done some. I mean, we definitely have not. We have not tested the melting point of the caffeine strip yet,
Yeah.
so I don't know that on top of my head. But the packaging is a really big deal, right? And there's a lot of different ways that you can actually package with like a nitrogen to keep it shelf stable for longer, and and I think right now most of them are in individual dosing, but versus the little plastic container the old Listerine strips used to come in,
Yeah.
right? So I think there is a little bit of that because these are medications that we want to be shelf stable for long term, but that's part of the process, right? And like I think that's the piece of the FDA process that a lot of people, if you're not in the space, don't realize, right? They're not just testing for effectiveness. They want to see that you have packaging that can be shelf stable. They want to see that the packaging is safe. They want to understand what happens if someone accidentally gives the wrong thing, or they take too many, or can a child go in and open that packaging? Those are all the nuances of it that can get really, really
Oh,
complicated. But for us, the advantage of being an existing IP that we've kind of gone through this before. We know the manufacturing process. We have those facilities. So huge advantage to working in a space where, I'm not starting from true zero in terms of the technology.
Yeah. Yeah. So speaking of the IP, is this something that you're like licensing, or is this like do you have any other ways of keeping it proprietary within the pet realm?
Yeah, so I mean, the technology itself is all patented. And so NanosVet as an entity basically has a full exclusive license, perpetuity to this technology for the animal health use case.
Oh, wow.
So we own the entire space for this, which is really great. It's very defensible. I think it would be very hard for somebody to kind of come up with a competitive strip. They could probably do something more simplistic, not using nanotechnology. I'm sure there are things people could try, but we feel really strongly about the defensibility about the tech itself. And then there are things that through the FDA process are really exciting, right? So I mentioned this kind of MUMS designation, which allows you to get a conditional approval. That also comes with 7 years of exclusivity from the FDA. So as an advantage of going under those conditions. So between the
That's so
technology,
cool.
between what the FDA grants you, there's a lot of really exciting defensibility here. That's why we can really confidently go into the space where we're competing with like the big guys, right? I think that's always a concern. This is a space where there's like 5 massive players that
Yeah.
own all of it, right? Like we're certainly not naive to kind of the space, but because we have such defensible IP, it puts us in a situation where I look at them as future partners, right? And they're people that we say like we have the ability to sub-license our technology out on like a medication per medication basis, as we want to partner with them. Like Cytopoint Costs is such a perfect example of one that I would love to partner on,
Yeah.
an opportunity.
Yeah, I
Man.
mean, I feel like it's kind of what was that company? EPG, that David's protein bar. They were
Mm.
getting the protein from, right? They ended up purchasing them, and
Oh
there was a
yeah,
big
yeah,
it was a big scandal. But they would kind of license that protein to all these different companies, and that would be able to lower the carbs or whatever that was. I feel like this is similar for you guys. Like there's so many companies, right, for with supplements, Fern Co, Joint Health, Anxiety, et cetera, et
Yeah.
cetera. And it's like if you could prove that it works with the supplements, because again, my dog, like anytime I try to give her like fish oil or any of that type of stuff, unless it's like flavored and it's got like a
Well, the
certain
chew
text.
format now, like the
Yeah, the
yeah.
chew.
chewables, you know.
Exactly. But if it's any type of pill, like my God, chew will just find it through the food. So again, if you could do that and prove that it actually works, all these companies come knocking at the door like, hey, we
Yeah.
would like these strips because it would, make make our lives easier essentially.
Well, I also learned that people in this space, they actually know off the top of their head there are certain substances, APIs, medications that taste worse than others naturally. So there,
Mm.
there are some things where it's a lot easier to make a good tasting chew or something out of, and maybe those are fine, right? Like those aren't the focus. But the ones where it's like we know this medicine tastes awful, right? Like it's the perfect example. So we can work with people on that and identify those specific opportunities because obviously everything's out there that we could go after. We want to go after what we have the biggest impact. So
Yeah.
Yeah.
that was a big learning for me here that people actually know the taste profiles of a lot of the medications.
All right, let's start forming nano supplements right now.
Yeah, there you
We'll
go.
start going
There you go.
after, because it's so funny. It's like as soon as it's so incredible in the pet space. Like you introduce a new modality, and it just like it almost feels like a whole new like dimension or layer has changed. And like to Roy's point, like the supplement space is a perfect example where it used
Yeah.
to be pill form, or it was like some liquid, and then some of them are still liquid, like MCT oil, which is like gotten
Mhm.
really popular. And like that is one that most of the feedback is my dog absolutely hates this stuff.
Yeah.
Um, it's disgusting. It smells like they won't eat it.
Yeah.
So it's just crazy that it feels like we just got to the like explosion of chewables, and here you are being like potentially, in some cases, like again, I know there's a lot behind the scenes, absorption rate, dosage, all that stuff, but it is like one of the things where I'm like, oh my gosh, there are so many things that have to be put into like a powder or
Yeah.
how do we make this into a
Absolutely.
chewable, and all the binders that probably go into that chewable people wouldn't love. But if you could get closer to the source, which you're already seeing that trend be really big in the treat space, where all these single ingredient companies where they're like, I can't read anything on the label anymore. I know this is
Yep.
chicken. It is just like, air dried chicken, perfect, or sweet potato, or it's a duck foot. And so it's like the closer you can get to the original source without having, copious amounts of like binders or fillers, I think people will just be like, yeah, this is a no brainer.
Yeah, yeah. Look, and there's some people that are very lucky, like you call them dogs that just like eat anything and like
Yeah.
amazing, right? Amazing. But there's nothing like seeing the person when I introduce this and you can see it on their face right away. They have a dog that just causes them so much anxiety because they can't get them to take their medication. I'm like, this is who I'm building for, right? Like
Yeah.
it's not to
Yeah.
go after it. Yeah.
Yeah.
I mean, there's really interesting. So uh, one of our advisors runs a mercy clinic his was getting in oncology for a long time. So dealing with some like pretty serious cases. But one of the things that he mentioned to me that really stuck with me as part of this journey was when he has a dog patient, there's a bunch of medications they have to take. He will actually rank them for the owner because what he wants to say is like, I know how difficult this is, and sometimes it's really hard for animals to take their medication. So if you can't get them to take them all, here's the ranking order that of most important to least important that you need to focus on. If you're only going to be able to get one or two pills down, like this is what you should focus on. And I
Wow.
thought that was so interesting, right? That is part of a protocol of a practicing veterinarian. That it's a known problem that we're just kind of accepting, right? And I don't know if it's that much easier if it's 10 items, but 10 strips in a dog's mouth. And maybe that's not practical either. But to get more of that list done, can be the difference of time, with someone's pet. So I thought that was really interesting and really stuck.
That is. Yeah. Um, I mean, that just goes to show you like how how much we've coped with a pain point like this for so long, that you're like, all right, well,
Yeah,
these would be
exactly,
nice to
exactly.
have, but these two you absolutely need to have. Honestly, even though like my dogs have it's almost a problem that they eat too many things like acorns, like bones that they find and like out in nature. It has its drawbacks, I promise. But like the other thing that's really difficult, and like I have a pug that we adopted, and we had to get 10 teeth removed. And it's a lot of it's
Wow.
like genetic, where it's just like crowded mouth. Like there's one was impacted, which affected everything else. But I have just been like tried to be religious with cleaning their teeth. And I do not buy into a lot of the dental chews. There's some newer ones on the market like pup gum, which actually has like a compound that's clinically proven to reduce tartar and things like that, which is amazing. But so many people like tout this like the mechanism, it'll scrape it. I'm like, I want to watch your dog chew this dental chew, because this is like it's like 2 bites and it's gone,
Yeah, my golden
And I'm
swallows
like,
some whole, so like I've given
I
up.
don't know what mechanical I'm getting out of that. So all it to say is like, if there's even something in the realm of possibility with this that could solve, periodontal disease, or like knock it down, or tartar or anything, like that would be my biggest use case outside of allergies. Like,
Yeah.
cause I
Well,
just think there
I mean,
hasn't been enough
We're already spinning up
change
like
in
10
this
different
space.
companies in this podcast.
no,
It's just
exactly,
these
right?
are, hey, when you that's what I'm saying, when you have a new modality,
Yeah.
it just changes the landscape, like chewables did with so many different
Hmm.
things. You're just seeing so many different product offerings in it. But it's like the one thing in the dental space where there's like powders now. Like I try to brush their teeth, one's really good. The pug's mouth is so small, it is so incredibly difficult, and he tries to eat the toothbrush, and it's just like there's got to be a better way,
Yeah, yeah.
So that's
Well,
like
and
where
that's what I love
I
about the
keep banging my
platform,
head against
right?
the wall.
The
Yeah.
platform puts us in a position where I can be in a position where I'm encouraging the entire world to go innovate and go solve that.
Yeah.
Find the medication, find the treatment, find the combination of things that's going to kind of solve that problem, and then we can partner, right? So
Yeah.
there are certain things that, of course, we'll go after directly at like epinephrine, but we as a team don't need to go solve everyone by ourselves. We can deliver our expertise and the technology and the modality, and help people create better delivery mechanisms for whatever innovation they're bringing to market. which I love,
Yeah.
right? It puts us in a position where we can be extremely, positive and supportive of the ecosystem as a whole, which I just think is great, in this space.
Yeah.
You ever gone back to that original vet and told him what has happened since?
Oh yeah, oh yeah. He
You
was one of the
have?
very first. He's one of the very first. And he is because he just. I remember that conversation. I said, hey man, I'm thinking about this thing. Like, we learned. You said there's no epinephrine. Like, I put this on a strip. What do you think? And he goes, yeah. I mean, if you can do it, that sounds obvious. And then that was kind of it. And I was like, that's
Sure,
all I
do
need.
it.
That's all I need,
Yeah.
doctor. Like, let's go. And, to show him, examples and be like, hey, so I got this thing. I got this caffeine strip. He's like,
Yeah.
you guys actually did
Yeah.
this thing. And it is cool. It is cool to go back.
Are you still in touch with him? Because that would be. I'm assuming. I mean, I don't know how many vets you've talked to, but I'm assuming there's probably a lot of interest and excitement, and he would probably be one of the first ones since he's with the lack of what he had to offer, sparked this whole new potential massive. I don't know how many industries we've talked about since, but massive potential industry.
Well, definitely. When we close this round, we're working on it. I gotta go take him out to dinner or something for sure.
Yeah,
So,
yeah, something.
Yeah.
he's definitely he's definitely
Michelin star.
Still current
Yeah.
vet, right? We see him, every couple months. So that's when I give him the quick update. So our vet visits are a little longer probably than the typical because we got to go through the business updates too.
Yeah.
Yeah. Yeah, seriously. When you're speaking with the vets, is there like a certain archetype of vet that is more accepting and interested and keen on this, like an integrative vet versus like traditional versus emergency, general like, are you finding that there's like avenues where you're getting a lot more feedback and kind of like acceptance of like, okay, if you can do these things, this would be super impactful?
I think what's interesting is that everyone becomes a vet, like gets into the business because they love animals, right? And it's kind of personal for them as well. And so when I bring this up, I always feel like they're immediately imagining like a real patient or real animal or a real pet parent that they've had to deal with or something in their mind when they're giving me feedback because they all have very strong opinions, right? And like, you should think about this next, or you should think about this opportunity. I think the one thing though that stood out was for them the ability to extend their care outside of the clinic. So the idea of them being able to give a solution to a pet parent that they can manage at home in a way that they trust them to manage at home, so it doesn't require emergency visit to come in. And like while there's been some really interesting economic questions there around like technically that doesn't become a vet visit, so maybe they're losing a little bit of revenue on the vet visit, but they're actually gaining revenue in a new prescription. I know it evens out enough for them to say that makes a lot of sense, but personally for them is the ability to say, you can take care of your pet based on my guidance at home that doesn't require you to come in. And I think that's been really cool, right? So like, Connor, I know we keep coming back to it, but Cytopoint's the perfect example. Like the idea to come in quarterly for that, a vet would much prefer to just send you that at home and, be able to kind of take care of it yourself as an example. The other that's come up is there's been some interest in actually using it in clinic. Where instead of in clinic they might be doing injections. Imagine Serenia, which is often used for like nausea and whatever, like before surgery, right? So instead of necessarily needing to inject that, being able to do kind of a strip in clinic, just because it's easier, it takes less people. If it takes one person to do the injection and one person to secure the animal, this could be just in the mouth, right? So there was a couple of people who were interested in about how it could actually be used in clinic, which is interesting. That's not where I had originally imagined it being used. But those are the ideas, man. Like they keep coming. I think both in the emergency and the kind of typical visit.
Yeah. Yeah, you're gonna have to just deal with people like us and other vets who are like, you should do this, you should do that, you could do that. All the
That's a
shiny
good problem
objects.
It's
Yeah.
a good problem to have. I'd rather have
All
more
the shiny
ideas than
objects.
too few. So.
Yeah, well, if you ever want more, well, I'm sure we can continue to throw them your way.
Yeah.
Because my wheels
Good.
are still turning. This is really cool.
Awesome.
I'm excited. to see where you guys go. So now the big thing is fundraising to kind of finish out this FDA, or continue through this FDA process.
Yeah, this type of business is way different from your typical like B2B SaaS, right? Your B2B SaaS is, go get your customers and show your revenue and kind of go through your fundraising rounds. The FDA process is so much more milestone based, and it's very kind of binary, either pass or fail kind of stuff.
Mhm.
So, this next phase for us is a very critical point where we're raising money to finish out the remaining clinical trials that we need to present that package to the FDA and get our conditional approval. The bright side
Yeah.
is, when we do that, we immediately get to go to revenue, which is really unique for a therapeutic product. We get to start selling in the market, which I'm very excited for. I can't wait to actually go get this to people. But yeah, that's the focus right now, and I've got a really clear roadmap.
Wow. Love it.
All right. I think what's the time? Yeah, just about hit our time. But this is super exciting. We'd love to have you back, when things are a bit have
Yeah.
progressed and are a bit more advanced and you have some updates. So we'd love to do it again. And
Awesome.
yeah, where are you active on social media? Where can people find you?
Yeah, you guys can find me on LinkedIn. My slash is green and so you'll find me there, and hopefully hitting the animal health circuit in this coming year. So come hang out. We'll bring some caffeine strips, and we can jam in person.
Very cool. All right, man. We appreciate your time. This was a lot of fun. And yeah, we'll do it again.
Awesome. Thanks for having me, guys.
Thanks, Andrew.